Necrotizing fasciitis is a streptococcus bacteria that is spread by contact with saliva or mucus from a person's mouth, nose, or throat. Necrotizing fasciitis can be spread through close contact with someone who is sneezing or coughing and can spread the disease into the air, kissing someone who is infected, or sharing of utensils and cups. The most common way to get necrotizing fasciitis is when your skin breaks and the bacteria enters the body. Some of the ways that can happen are through cuts, scrapes, puncture wounds, or bug bites. Many people who are susceptible to necrotizing fasciitis already have other health problems that lower their body's ability to fight the bacteria, such as diabetes, kidney disease, cancer, or other long-term health problems. Even people who have fantastic immune systems cannot hold this disease off very long because it is so aggressive and fast-acting. So if you are healthy and you have a good immune system and have good hygiene, as well as no proper first aid, washing the wound and keeping it clean and dry with the Band-Aids for cuts and scrapes, your chances of becoming infected are extremely low. So what do you do if you think that you have necrotizing fasciitis? The very best thing that you can do for yourself is to go see the doctor immediately. The sooner a diagnosis is made, the earlier treatment can begin, and the patient will more likely recover from the infection and avoid complications. So go see your doctor. Again, prompt treatment is extremely critical. The first line of defense against this disease is strong antibiotics given through an IV. Because the bacterial toxins can destroy soft tissue and reduce blood flow, antibiotics may not be able to reach all of the infected and dying areas. And this is why rapid surgical exploration and debridement, in addition to the antibiotics, is critical to stopping the infection. The longer that you wait, the riskier it is to receive antibiotics that will work. So now what? If your doctor has discovered that you do indeed have the flesh-eating necrotizing fasciitis, two things are going to happen. A very intense and aggressive antibiotic therapy will begin via IV, and secondly, surgical debridement of the infected area will start, and this means removing all of the infected skin and muscle tissue. From there, hopefully, you'll improve, and you'll continue to still get antibiotics and critical care. If not, and you worsen, doctors will reassess the antibiotics and possibly change them up, and more debridement will happen to keep the infected area as clean as possible. And if things get worse from there, and the continued sepsis happens despite all of the antibiotics and debridement, you'll undergo another round of debridement, and the doctors will consider amputating the infected part of your body. While you're in the hospital, some of the antibiotics that you might be able to see include penicillin, clindamycin, metronidazole, and aminoglycosides that are very specific to treating certain kinds of gram-positive bacteria, such as necrotizing fasciitis. One or a combination of these drugs will prevent or aid in further sepsis, and all of these medications are given via IV.